Every year, over 40,000 patients in the U.S. die from misdiagnosed conditions. That's not a headline, it's a quiet crisis. Now imagine a system that spots what human eyes miss, not by replacing doctors, but by enhancing them. In hospitals across the globe, AI is already doing just that. It's not flashy, no alarms or sirens, just smarter, faster, more accurate diagnoses. From spotting subtle signs of lung cancer in CT scans to predicting heart disease before symptoms arise, machine learning is rewriting the playbook. But how did we get here? And why now? This isn't just about technology, it's about lives. As we peel back the layers, you'll see how algorithms trained on millions of medical images are outpacing traditional methods, reducing errors, and saving time. The revolution is here. It's just not making a sound. Behind every missed symptom and delayed treatment lies a staggering human and financial cost. A recent report found that in the U.S. alone, 12 million adults experience a diagnostic error each year. Many of these errors are preventable. Researchers say 40,000 to 80,000 people die annually as a result. Consider a patient misdiagnosed with a common infection when the real issue is a progressing cancer. Valuable time is lost. AI is increasingly applied to diagnostics, offering second opinions with speed and precision. Take one hospital system that implemented AI imaging tools and saw a 30% reduction in diagnostic delays. These tools analyze patterns too subtle for the human eye, catching anomalies in X-rays and MRIs. Artificial intelligence doesn't just promise efficiency, it offers a chance to save lives. As we explore the role of AI in diagnostics, it becomes clear. The future of accurate medicine may lie in machines that learn faster than we do. In 2017, a Stanford-led study revealed that an artificial intelligence system could detect skin cancer with greater accuracy than board-certified dermatologists. The AI analyzed thousands of images of skin lesions and matched or exceeded human diagnostic performance. This breakthrough demonstrated the potential of machine learning to augment, and in some cases surpass, expert judgment in critical healthcare settings. Consider that AI in healthcare is already being used for surgical navigation and risk prediction, with applications expanding rapidly. Researchers say these tools can reduce diagnostic delays and improve outcomes, particularly in underserved areas where specialist care is scarce. Picture this: a rural clinic using an AI-powered app to screen patients for melanoma in real time, empowering local providers and saving lives. As AI continues to evolve, its role in early disease detection is becoming harder to ignore. This leads us to how these systems are being integrated into hospital workflows. In the quiet realm of medical imaging, AI is uncovering secrets hidden in plain sight. A recent report found that deep learning models can detect breast cancer in mammograms with greater accuracy than 6 out of 7 radiologists. Consider a case at Google Health, where an AI system trained on over 25,000 mammograms reduced false negatives by 9% and false positives by 5%. These aren't just numbers, they represent lives potentially saved by spotting what the human eye might overlook. Researchers say AI excels at recognizing patterns in data too subtle for even the most experienced clinicians. Take diabetic retinopathy, a condition that can lead to blindness. AI algorithms trained on retinal scans have reached diagnostic accuracy comparable to ophthalmologists. This ability to see beyond the visible is redefining precision in healthcare. As AI continues to learn from vast datasets, it's not replacing doctors, but equipping them with new vision. That vision will be crucial as we explore the next frontier of diagnostic innovation. In 2020, Google Health deployed an AI system to analyze mammograms, achieving a 5% reduction in false negatives and a 9% drop in false positives compared to human radiologists. These results, published in Nature, highlight a critical shift in diagnostic accuracy. Consider that breast cancer is the most commonly diagnosed cancer in women globally, with over 2 million cases reported in 2020 alone. An AI capable of reducing diagnostic errors could significantly impact early detection and survival rates. Beyond mammography, AI is being applied to surgical navigation and personalized treatment planning, as noted in a recent report by the Journal of Medical Systems. One striking case is the use of machine learning to predict sepsis in ICU patients, where early alerts have reduced mortality by up to 20% in pilot programs. As these tools evolve, they don't replace doctors, they augment them, offering a second opinion with unprecedented precision. This quiet transformation is setting the stage for smarter, faster, and more accurate diagnoses across the healthcare spectrum. In the evolving landscape of healthcare, AI is not a replacement for human expertise, but a powerful collaborator. A recent report found that AI-assisted diagnoses can improve diagnostic accuracy by 11 to 15%, a significant leap in precision medicine. Consider the work at Massachusetts General Hospital, where AI tools help radiologists detect subtle anomalies in imaging that might otherwise go unnoticed. These systems don't make decisions, they highlight possibilities, allowing clinicians to focus their expertise where it matters most. Researchers say this partnership reduces diagnostic errors and shortens response times, especially in critical care settings. Picture this: an AI model analyzing retinal scans for signs of diabetic retinopathy, flagging cases that might slip through the cracks during a busy clinic visit. This isn't science fiction, it's happening today in hospitals worldwide. As trust in AI grows, so does its role in supporting, not supplanting, medical professionals. With this synergy, the next frontier is not just better technology, but better healthcare outcomes. In ophthalmology, AI is restoring clarity to vision care. Consider a 2018 breakthrough where a system developed by Google and UCLA diagnosed diabetic retinopathy with 90% accuracy, matching expert human evaluations. This disease affects nearly 1 in 3 people with diabetes, making early detection critical. A recent report found that AI tools can analyze retinal scans in seconds, identifying subtle signs often missed during routine exams. Take another case. In rural India, where access to eye specialists is limited, AI-powered screenings have expanded early diagnosis to millions. Researchers say these systems reduce human error and accelerate treatment. Beyond retinopathy, AI is now detecting glaucoma, macular degeneration, and even signs of hypertension in the eyes. One striking case involved a patient whose AI scan flagged early-stage glaucoma, leading to timely intervention. As these systems evolve, they are not replacing doctors, but empowering them with precision and speed. This quiet revolution in vision care is just one lens into AI's broader impact on diagnostics. When errors creep into diagnosis, the cost isn't just measured in time or pain, it's in dollars. A 2017 study by the Society to Improve Diagnosis in Medicine revealed that misdiagnosed patients spend 2.5 times more on healthcare than those who receive accurate assessments early. This isn't just a financial burden, it's a systemic strain. Consider the case of a patient misdiagnosed with lupus when the real issue was a rare neurological disorder. Months passed before the correct diagnosis, and the unnecessary treatments drained both the individual and the healthcare system. AI is stepping in to close this gap. Researchers say machine learning models can analyze medical images with 96% accuracy in some cases, surpassing human performance in specific diagnostic tasks. Take diabetic retinopathy screening, where AI tools now flag early signs in eye scans with precision rivaling that of top ophthalmologists. As these systems evolve, they promise not just faster diagnoses, but more affordable, efficient care, ushering in a new era where waiting no longer means wasting. In pathology labs across the globe, AI is sharpening the edge of cancer detection. PathAI, a leader in this field, employs machine learning to analyze biopsy samples with precision that rivals, and in some cases exceeds, human pathologists. A recent report found that AI-enhanced diagnosis can reduce false negatives in breast cancer detection by up to 30%, a critical advancement in early-stage care. Consider the work at Brigham and Women's Hospital, where AI models trained on thousands of tissue samples now flag subtle anomalies that might otherwise be missed. Researchers say this level of accuracy is especially transformative in regions with limited access to specialist pathologists. In India, for example, AI-assisted diagnostics are being deployed in rural clinics to identify cervical and colorectal cancers more reliably. As algorithms learn from more data, the potential for earlier, more consistent diagnosis grows. This isn't just about better tools, it's about redefining the very standards of pathology. The next frontier lies in integrating these insights into broader treatment strategies. Natural language processing is revolutionizing how we detect and diagnose complex health conditions. A recent report found that AI systems can analyze patient records and symptom descriptions with remarkable accuracy, often flagging rare diseases that might otherwise be missed. Consider a case in point. Researchers developed an NLP model that combed through electronic health records and identified subtle language patterns linked to early-stage Parkinson's disease, sometimes years before a clinical diagnosis. These tools don't just read words, they interpret context, tone, and even the way symptoms are described. One striking example is an AI tool used in the UK that reduced diagnostic delays for rare conditions by 30% by analyzing patient-reported symptoms in real time. This isn't just about speed, it's about catching what human eyes might overlook. As language becomes data, the lines between symptom and diagnosis blur, opening new frontiers in precision medicine. This evolution points to a future where words themselves become diagnostic tools. AI is making waves in mental health, offering new ways to detect conditions like depression and anxiety. A recent report found that machine learning algorithms can analyze speech patterns with up to 85% accuracy in identifying early signs of depression. Researchers at Stanford have developed tools that assess tone, rhythm, and word choice in conversations, flagging subtle changes that may signal a decline in mental well-being. Take, for example, a pilot program in the UK where AI monitored social media activity and online interactions to identify users showing behavioral shifts linked to anxiety. These tools don't replace therapists but act as early warning systems, enabling timely intervention. In a field where symptoms often go unnoticed until they escalate, AI offers a proactive approach. As these systems become more refined, they could help bridge the gap in mental health care access, especially in underserved regions. This quiet shift in diagnostics is redefining how we understand and respond to mental health challenges. Contrary to widespread concerns, AI in healthcare isn't eliminating jobs, it's evolving them. A recent report found that 80% of doctors using AI diagnostic tools report higher job satisfaction, thanks to reduced administrative burdens and more time spent with patients. In radiology, for instance, AI doesn't replace radiologists. It enhances their ability to detect anomalies with greater speed and accuracy. Take the case of a hospital in Boston, where AI-assisted imaging cut diagnostic review times by 40%, allowing specialists to focus on complex cases. Researchers say this shift is creating new roles in AI oversight, data interpretation, and patient communication. The field is not shrinking, it's expanding, with demand for hybrid professionals who can bridge medicine and technology. As AI becomes more embedded in diagnostics, it's not a question of jobs lost, but of roles transformed. And that transformation is already underway in clinics and hospitals across the globe. In remote villages where specialists are scarce, AI is stepping in to close the diagnostic gap. A recent report found that AI-powered diagnostic tools can detect conditions like diabetic retinopathy with 95% accuracy, rivaling expert human assessments. In India, for example, mobile clinics equipped with AI imaging systems now screen thousands of patients annually for eye diseases that could lead to blindness, conditions often missed due to a lack of ophthalmologists. These tools don't just detect disease, they send results instantly to doctors hundreds of miles away. In sub-Saharan Africa, where 80% of the population lives in rural areas with limited healthcare access, AI is being used to analyze ultrasound scans for fetal abnormalities, enabling early intervention. By automating preliminary assessments, AI allows local healthcare workers to act swiftly, reducing the burden on distant hospitals. As these systems become more affordable and accessible, they're not just improving care, they're saving lives. This shift marks more than a technological leap. It's a redefinition of what's possible in underserved communities. AI is not here to replace doctors, but to amplify their abilities, creating a healthcare system that is more precise, inclusive, and efficient. A recent report found that AI tools in diagnostics can reduce human error rates by up to 30%, particularly in imaging and early cancer detection. In rural India, for instance, AI-powered diagnostics are being used to analyze X-rays and blood tests, bridging the gap where specialists are scarce. This is not just about technology, it's about transforming lives. As AI continues to evolve, it's not the machines we should focus on, but the outcomes they enable. Faster diagnoses, better treatments, and more time for patients and caregivers. If you want to stay informed about how AI is reshaping medicine, hit subscribe and check the description for sources behind today's insights. The revolution is silent, but it's happening.